Hi, I'm going to demonstrate mouth care, brushing teeth. With this skill, you want to make sure that you brush every surface of all the teeth. And I'm talking about the outer, the inner, and the chewing surface of the teeth. You really need to brush someone's teeth in your lab just so that you can brush an adult person's mouth before you go to clinical. You shouldn't just pretend. We have toothbrushes in our lab and we have toothettes, and you can use either one. The toothettes, you know, people usually they'll try these just because they've never tried them. You just stick the stick through the bottom and then you grab this. I usually use about 5 of these to brush someone's teeth because it gets real mushy. So, and then I usually just stick them in the water, just drop them all in the water and use them. Miss Karen has chosen to use a toothbrush to have her teeth brushed today. But I have done my entrance behavior. I've closed my curtain. I've got my equipment together, which includes an emesis basin, a tube of toothpaste, the toothbrush, and I needed a cup of water. And then of course my gloves. This is a skill that you definitely need gloves with, and you need clothing protector. You can certainly use a towel, a clothing protector that you use for feeding, or you can use a paper towel. You also need a paper towel to wipe their mouth. Okay, this skill can be done in bed or it can be done in the wheelchair at state. It really depends on your state evaluator. Okay, so Miss Karen, it's time to get your teeth done.
Okay.
Okay, so I'm just going to raise the bed to a good working height. All right, and I'm going to bring your head up just a little bit more.
Well, we're eye to eye now, aren't we?
We sure are. There we go. You gotta make sure you're able to spit okay.
Oh, yeah.
There we go. Okay, there we go. Okay, so then I'm just gonna go ahead and I'm gonna make sure that we don't get your pretty shirt all messed up there, okay? And I'm just going to go ahead and I'm going to put this here just so that I can wipe your mouth pretty quickly. Okay, I don't wanna be searching for it. Okay, and I'm gonna put this here so I can grab that quickly as well. If you don't have a sanitizer to clean your emesis basins in your classroom, you might want to use just like a spit cup. Get another cup and just have your students spit in a cup, and just remind them when they go to state, they make sure that they use a emesis basin. And then of course, when they're in the clinical area, they will use an emesis basin for their residents as well. I think I might have grabbed some small gloves. Okay, so you will dip your toothpaste or toothbrush into the water. It is a clean toothbrush, and then you will also then get your toothpaste and put some toothpaste. Would you like a drink of water before we start?
No, thank you.
So you want to offer that to your resident, okay? And then you always want to brush the top of your teeth first, because there's not as many salivary glands up there and they won't drool as much, okay? So can you open your mouth? And then remember, their mouth is a little flexible, so go ahead and just relax your mouth just a little bit for me. There we go. Okay, so we're just going to go ahead and we're going to brush, okay? And we're going to be at like a 45-degree angle. We're going to make sure that we get back there, make sure that we get plenty of it in there, and then we're going to come around and we're going to get the inner and the outer and the chewing surface. And you might want to make sure that you tell your evaluator that you're doing the outer, the inner, and the chewing surface of the teeth, because they may not see that. Wait a minute. make sure I get all the toothpaste in there, okay? Okay, do you need to spit?
Oh,
Okay. Okay, you want to turn this way just a little bit? There we go. Well, your mouth looks good. You don't have anything. Somebody's been doing your mouth care for you. That's good. Okay, so we do the outer, the inner, and the chewing surface. Okay, go. Okay, tongue. Okay. Okay, let's go ahead and spit. There we go. And then we're going to go ahead and get some water and swish. Okay. Okay. And we're going to go ahead and wipe. There we go. You need to spit again.
I think I'm good.
You good?
Mm-hmm.
How's your mouth feel?
Nice and fresh and minty clean.
Good. Okay. So then we're going to go ahead and we would clean out her toothbrush. I'm just going to set that right in the cup there. Okay. We got our clothing protector off. Move that out. We want to make sure that we don't spill anything. Okay. And then we're going to go ahead. I'm going to go ahead and lower her bed so that, you know, we don't want her toppling out. I'm not going to throw this into my toilet. Okay. I'm going to throw this right down the center of my sink here because it's easier for me to clean. Okay, so once you're finished cleaning your equipment, you're going to go ahead and take your gloves off, and then you're going to finish putting the rest of your equipment away and push your curtain back, put your call light within easy reach, put your side rails down, and you can exit the room. And that's it.